Alright, today I'm going to do an O2 scenario. So the first thing I'm going to do is check the patient's chart, and I got a notification that the doctor would like this patient to be on a Venturi mask at a set FiO2. So the first thing I'm going to do is introduce myself to the patient, knock on the door, and then I would check the ID band just because we want to make sure we put oxygen on the correct patient. And then I would do the pre-vital signs before I place them on oxygen and listen to their lungs. So when I'm ready, I would explain to him this device. All right, Mr. Johnson, this is a Venturi mask, and so with this, this is just going to help you get a set oxygen rate. That way you can have a set flow. And unlike other devices, this device will keep that rate. So we're going to have it at 31%. So that's going to give you that 31% at all times. So I asked that it's going to be noisy, a little noisier than most oxygen masks. So please leave it on, as this can affect your rates of oxygen, and it can mess with you and it can make things difficult on you. So the first thing I'm going to do is I'm going to place it into here. I'm going to turn up to flow. I'm going to have 4 liters per minute. And so I'd always make sure there's a flow coming through the mask before I place it onto the patient. Make sure it's set at the appropriate percentage that the doctor would like to be at. So then I set them on the patient. All right, so I'm going to set this on here. Put this right behind their ears. And then I tighten it if need to be. It could stay. And then I would pinch the nose piece just to make sure that it doesn't move from their nose. And then, alright, I know it's noisy, and then I ask that you don't cover this part, because then it won't get the appropriate flow, and then you're just going to get straight action if you do that, okay? So when I'll come back after a bit, I'll get their post-vital signs here, and then I'll come back after a bit to check on them. So I'm going to leave. And so I got a notification that the patient would like to eat. So I'm going to go ahead and place them on a nasal cannula so that way they can eat. Hi, I heard that you would like to eat today. Good deal. Alright, so I'm going to put you on a different device so that way you can eat, because I know it would be a little difficult with that mask on for you to eat. So I am going to change you to a nasal cannula here, okay? So I'm just going to shut this off, and I will flip you over to it, okay? Alright, and then I'll just set this off to the side in a safe place there. And then here we have a nasal cannula. I ask that while you're eating that you leave it on at all times, not to move it, because it can cause sores and dryness to you. So when you are done eating, just give us a call, and I will change you back to your other mask, okay? So I'm going to place this on. So since it's at 32%, we want to make sure we have it at the similar percent rate that the patient would get with the Venturi mask. So I'm going to set it at the 4 liters per minute, because I'll get them to the rate that they need to be at. And then I check the flow. So the flow is good. And so with this, I'm going to place the nose piece right here. And then I would place it around like that. I would go in like that. And so once I have it placed on them, I need to make sure their vital signs stay stable, make sure their SpO2 is okay, just because I switched to a different device and while they're eating, and then I'll come back and check on them to make sure they're doing okay on that device. So once I'm done and I have checked the patient, and then when they're done eating, then I'll place them back onto the Venturi mask, which is what the prescribed O2 devices that the doctor had. And then I will chart it in their charts that I switched to the nasal cannula so they could eat, and then I changed them back to the Venturi mask.